Diabetes is a growing epidemic in our country, and over a third of all patients with diabetics are at risk for developing a foot ulcer. That foot ulcer can get infected, and about half of our patients that we see have peripheral arterial disease and diabetes end up with a lower extremity amputation because of uncontrolled infections in their feet. And you can imagine this causes a dramatic detriment to someone's lifestyle, not being able to walk on their feet and losing their independence. We don't have a great cure for this, and my research focuses on methods on how we can understand why this happened and how we can prevent it from happening before a patient develops an infection that will need an amputation.
I think what positions Tammy so effectively is the combination of being a strong clinician as well as a scientist. I think she really knows the right questions to ask because she sees these patients every single day and is able to think about what are those unmet needs. Her focus has clearly emerged as trying to improve our understanding around diabetic wound healing and how the immune system is involved in that. And I have no doubt that over the years, Tammy is going to really transform our understanding of how basic wound healing works, both in diabetics and non-diabetics.
The Wylie Scholar Award offers a unique opportunity to support young surgeon scientists like myself. There's not very many venues out there that support surgeon scientists specifically focused on patient-oriented research in optimizing vascular health and specifically peripheral arterial disease.
There are many incredibly important aspects of the Wylie Award. It's an affirmation of the value of the work and the talent of the investigator. And I think that is extraordinarily important. I mean, you cannot undervalue how much it means to a very young person who's really working very hard to establish their own research, to have an institution, a foundation like the Wylie Foundation place their trust on that person. So to me, that is of enormous value and can only really massively enhance the mission of the foundation, which is so incredibly important.
Having the recognition and also the financial support that the award comes with allows me a lot more creative freedom to start to explore and ask scientific questions that otherwise I would be limited without the funds and support. And also Vascular Cures brings a great community of other vascular surgeon scientists that they've introduced me to help fuel collaboration and develop new techniques and further my development as a surgeon scientist and also increase the sophistication of the questions that I can ask.